this is Carrie.
Today we're going to be talking about lateral knees. What a knee slapper! So for expediency's sake, I have already pre-detented and pre-collimated. I have placed our cephalic angle at 7. I have noticed that 7 is the sweet spot for the majority of patients, but you do have that laterality between going from 5 to 7 degrees cephalic angle. So to start, we're going to have our patient roll onto their right side. I'm going to place the unaffected leg onto a sponge. This helps to stack our hips and to stack our shoulders. If our shoulders and our hips are stacked, then our knee is placed in its own natural alignment. I'm then going to extend the thigh out straight. This allows me to see if I need to bend or extend our knee to get to that good 20 to 30 degree flexion. So I'm going to slightly bend our knee. Now comes the centering. I'm going to have my vertical lines follow and track along where my femur is. I'm going to put my horizontal lines to split between my patella and my popliteal. So I'm going to put my vertical or horizontals right there. This allows a happy little corner right here for my marker.
But Carrie, how do we tell if it's over or under rotated?
I'm happy you asked. So if I'm over rotated, then that means I'm placed too laterally, or the patient's knee is rolled more towards the table. If you see how my heel is too far up for that rotation. If I'm under rotated, my knee is away from the table, or I'm medially rotated. And if you see, the toes are away from the table. So there's two different ways to counteract this, and I look at the heel. To counteract the medial rotation, I'm going to set a sponge underneath the heel. This is nice because it helps with patient positioning, but it also assists the patient from not straining from holding that position. I'm looking at you, all you Winifreds out there. And then again, to counteract, if I was already in that medial extension or lateral extension of over rotating, to fix that, I would place my sponge under the toes to help roll the knee so that those condyles are stacked. And that's how you take a lateral knee.
And this is a perfect lateral knee using tips and tricks with Carrie.